Hi, everybody, and welcome to this very special edition of the Dr. Keith Darrow Podcast, where I have not just one awesome expert with us today. We have two people with us today. We have Dr. Noel Crosby and Rebekah Perry, who are joining us today to talk about CBD and the role that CBD can play in hearing healthcare, perhaps even and beyond, how this may be a great option for our patients who are living with bothersome and debilitating tinnitus. Dr. Crosby, Rebekah Perry, thank you so much for being on the show today.
Thank you for having us. We're welcome. We're happy to be here.
Yeah, it's so I guess before we sort of dive into the real topic at hand, tell me, I guess, a little bit about your history. Noel, Rebekah, your history, how you guys met up and how this sort of all started in the last decade or so.
Yeah, I will start with that. So probably in 2018, I had a pretty well-known physician approach me, and he asked me if I wanted to investigate CBD for tinnitus. And at the time, I was looking to expand my tinnitus program, and I was really interested in CBD, and I thought I knew everything about it. So I thought I was an expert because I was, an ex-hippie, and I thought I knew everything about
personal use doesn't make you an expert, Noel. I'm sorry.
So I didn't realize, that there was so many different components of the hemp plant or the marijuana plant. So I decided, I think I am interested in learning more about it and possibly doing some studies to find out if it would help with tinnitus. And so I started investigating, and I learned, and the more I learned, the more I knew I didn't know everything. And then I learned more and more and more. So before I met Rebekah, I was involved with a different company, and I was using CBD in my office, and I was experimenting with my patients to see if it would help them and in what ways it might help them. And then probably a year ago, I had another friend of mine decided that we should do a private label CBD. And we were using a different company. And then I was introduced with Rebekah. Somebody introduced me to Rebekah about a year ago. And then I realized that Rebekah was going to school to get her master's in cannabis. She will tell you exactly what it's called. Education, it's medicine and therapeutics, but she'll explain it to you. And so I knew the wealth of information that she would have would be just amazing in helping my patients as well. So now I'm just going to segue into Rebekah, and she'll tell you a little bit about herself.
Perfect. And Rebekah, if you don't mind, right before you go, I would love to know, Noel, what was your initial reaction when somebody came to you and said, "Hey, what do you think about CBD in your practice?" Right? Because I certainly know I've been discussing it with my patients for quite some time now. In that, look, if you find relief from it, go for it. Right? I don't have a prescription to write you. I'm not going to, tell everybody to do it necessarily. I don't know enough about it, but if it works for you, go for it. So what was that initial gut reaction like? Is this guy nuts? Is this something we should do?
Well, it was interesting because it was at a time when medical marijuana was just coming in. And a lot of people did not know that the difference of anything, of hemp, was it hemp from marijuana? I mean, was it CBD from marijuana? Was it hemp? Was it marijuana? Was it THC? Was it isolate? Was it not isolate? Was it legal? Was it illegal? And there was just so much information coming on the news and in the newspaper all the time. So because when I decided to learn about it, I realized, the real difference, and that the CBD from hemp didn't get you high and it would be legal. So when I started it, I started just like I thought I'm just going to ask a couple of my patients what they think of it. So I would just say, I've been experimenting with CBD. Have you heard of it? And some people would say, oh yeah, honey, I already have my medical marijuana card and I'm going that route. And then other people would say, no, I've never heard of it. I also realized that the people wanted to hear about it because they had seen it in the paper and on the news, and they didn't know what it was. Like, how could it help me? And what is it? So I just remember having a seminar, and I had 75 people at this seminar, and they all came because they wanted to learn about CBD and what it was. So to answer your question, at first I was a little cautious. I thought I didn't know how the people in the community would take it, how the other professionals would. But then as I started learning more and knowing the need and also seeing what it could do for people, I thought, this is something that I really need to help educate people about.
Yeah, it's not the 1980s anymore. We're not with the war on drugs.
Right.
All right. So sorry, Rebekah, I know I cut you off. I do apologize about that. I would really love to learn more about your experience and where you come from with CBD and exercise physiology, how you came to be here.
Okay. Well, initially I played soccer in college at University of Georgia. And I had one of my best friends actually suffer a spinal cord injury. And that led me down the path of working at the Shepherd Center here in Atlanta, which is a brain and spinal cord injury rehabilitation hospital. And it was working with those patients and seeing, them being on such high medications and struggling for just the smallest bit of function or the smallest bit of relief from their pain. And they themselves were actually taking medical cannabis. Mm-hmm. So I really learned from them taking it. And these patients are coming from all around the country. So some people did have access to it from their initial state that they were in legally. So they really knew what they were doing with dosing medical cannabis. And that's when I decided to go back to school for more education. And that's when I went to the University of Maryland Pharmacy School. The program is Medical Cannabis Science and Therapeutics. And it's the nation's first graduate program for medical cannabis. So really, really highly focused on dosing, understanding the plant as a whole, but down to the chemical aspects of what happens when you take this plant and what happens when you digest it, what happens in your body. And the biggest focus is going to be on dosing. So that's what me and Dr. Crosby do. We talk to patients about, their symptoms and try to get them some relief. And a lot of times that starts with just getting them on a consistent sleep regimen. That is really a huge fundamental piece of our health. So even just starting with getting on the basics down, which CBD is so helpful for, that it really makes a huge impact on your overall health.
So tell me a little bit more. I mean, you jumped right to the, CBD sleep. I mean, I think, and I say that because even though there's a lot more education, there's a lot more knowledge, and there's certainly a lot more cannabis dispensaries popping up around the country, I think there's still, I don't think I'm alone when I, look and I see a power drink made with CBD or a cookie made with CBD or this or soap made with CBD. Like, what break down some of the science for me on CBD versus, smoking weed on the corner.
Okay. So the first thing is that it comes from the same plant.
Okay.
You want to think about cannabis as like the big umbrella, and then marijuana plant or a hemp plant. So a marijuana plant is shorter and stockier, while a hemp plant is actually taller and skinnier. So that's why some states are legal to grow hemp only. A hemp plant that can have a marijuana plant can have up to 35% of THC, and while a hemp plant can have 3% of THC. So very low amount of THC is actually going to be coming from that hemp, but you can harvest from there. But again, our CBD is going to be coming from a lot of that hemp plants. And again, CBD versus THC, CBD is not psychoactive whatsoever, while THC is. And they're just, what they're doing in your body is completely different on a scientific level.
So THC gives you the munchies, and the CBD does what?
The CBD can also increase appetite, which is awesome.
Okay.
So, but what we're doing, just like your skeletal system, just like your muscular system, you have what's called an endocannabinoid system spread all throughout your body. And this is a system of receptors, so which are already placed in your body, which is why CBD is able to do so many things that you've read about in the news or seen in the media. It can help with anxiety. It can help increase appetite. It can help with my pain. That's because these receptors are spread throughout your whole body. Now, I'll get a little bit more scientific and say CB1 receptors are located primarily more in your brain, while CB2 receptors are spread throughout more of your peripheral body. So that's great to know, because we can actually target specific receptors with our medical cannabis product. So
interesting.
Yes.
I mean, I've certainly heard of the endocrine system, the digestive system. I teach anatomy and physiology at the university. I do not yet have a lecture on the endocannabinoid system, but you're certainly pushing me in that direction, because this is something I think we all need to learn more about. I certainly, as a neuroscientist, I understand the concept of receptors and how that works. And so are you able to specifically target C1 versus C2? Do they do different things? I mean, maybe I don't want to geek out too much.
We have a whole lecture on this too, that we can always share with other people too.
Oh, excellent. And if you have something pre-recorded, we'll definitely link it in this podcast. That's great.
Okay. So when we're talking about the receptors, this is why I say THC and CBD are totally different. So when you take that product and it gets into your bloodstream and it gets attached to those receptors that are spread all throughout your body, THC is, I like to think of it kind of like offense versus defense. Okay. THC is always in offense mode. It's going to bind to those receptors and send a signal immediately through the cell. It's sending. Now, CBD, when it binds to that receptor, it can actually even kick THC off. That's how strong it is. They can compete for those receptor sites. CBD can bind to it, and it's actually more of a balance at that receptor cell. So it's saying, how much is in here? There's too much. You can't come in. Okay, we don't have enough of this. We're going to open this channel so all of this can come in. So it's finding homeostasis at that cellular level at the receptor site. So that's really how we can focus on treating at the source of what's causing the symptom.
Now that's interesting. And I'm going to come back to you in a couple of minutes and talk to you about dosage in this, because now I want to go back to Noel, right? I gravitate back towards that hearing healthcare professional. How does this knowledge, how do you now start to integrate this and say, you know what, this is now something that I believe in, the science is there, and I want to use this to help my patients?
At first, I was hoping that it would help with just decreasing tinnitus or getting rid of tinnitus. Now, I will tell you that doesn't really happen very often. You just can't get rid of it with CBD. It can happen, but it's very rare.
Sure.
Typically, what happens is it helps with the person's anxiety and it helps them sleep better. So as you know, the louder your tinnitus is, the more bothered you are. And it's this cyclic thing where the more anxious you get, the louder the tinnitus is, the more the person focuses on it. So the worse it gets. So if we can just take the edge off of it, the person's not as anxious, so they're not focused on it as much, and they're sleeping better, then they say that their tinnitus is not as bothersome to them. Yeah. So I like to use it as one part of a total tinnitus comprehensive program. Of course, hearing aids being one if they have a hearing loss, and then this as an added benefit if they are anxious and if they're not sleeping. So I've found that it's been very successful for that.
Noel, do you know, does the we sort of, I think what we're really supposed to be doing is following, medical guidelines, evidence-based research, do you know of, one of the, I think the most recent standards on treating tinnitus came out. It's about 4 years old now, from the American Academy of Otolaryngology, Head and Neck Surgery. And as you said, unequivocally, hearing aids, number one, most confident, most, highest level of research to help reduce the experience of tinnitus. Do they have a stance yet? Has there been a public statement on integrating CBD into the treatment of tinnitus?
Not that I know of.
Okay.
I don't think, Keith. I think that I heard from a good source that the American Tinnitus Association is going to start, they're going to introduce some protocols that are related to sleep and different things like that. I don't know all the details.
Right.
But I think the problem has been, and Rebekah and I have been experimenting with this, is that there have been some studies that have shown that CBD has increased tinnitus, but it's CBD with THC in it. And we don't really know what kind of CBD or how much THC or any of that. And so we've actually been experimenting with using CBD isolate without any THC. And so that's been pretty successful for us in terms of people saying it's taken the edge off. I'm handling it now where I wasn't before. So it's really helping them just live their life their daily life in a better way, because some of these patients were really stressed out about it. So to go back to your question is, I don't know that they've had enough studies on it with the different types of CBD and THC and everything. I think we'll get there soon, but I don't think there's a recommendation for it at this point.
Gotcha. And so back to that. So now I come back to you, Rebekah. How have you formulated your recommendations when it comes to, you use the word dosage several times, which makes me think that's probably one of the most important parts, is figuring out the right dosage. So how do you do that without, at least as far as I know, without a ton of evidence-based data? Obviously, you went through a master's program, you know more than I do. So tell me about that process for dosing and prescribing.
So again, we start with always asking if the patient would do a patient consultation. We offer this for free. It's a phone call where we're getting really the patient history and lending an empathetic ear about their symptoms. And this is where I like this part, because I get to be a little bit of an investigator and understand the patient as a whole, because they might be, again, saying that they're having their tinnitus symptoms, but it could be a lot of other things that we can address that can help reduce some of those tinnitus symptoms instead of focusing on the tinnitus specifically. So we break it down into their short-term goal and their long-term goal. Obviously, we're interested in what other medication they may be on, what they've tried in the past for their tinnitus. We always ask about their sleep, just really getting a fundamental look at the patient and then getting back to us about what their preferences may be for intake, because there's so many different options for methods of intake, whether it's inhalation, whether it's a sublingual oil, a gummy. We educate all about different methods of intake, and again, what the patient would prefer to incorporate into their lifestyle, because that is one of the biggest things that I like to encourage, is that this is more of a lifestyle change than anything. This isn't just pop a pill and fix your pain. This is really, we're starting at the basics, again, trying to find more of a balance in your body at a cellular level. And on a daily basis, you're going to be making improvements. So that's really why open communication with the patient is so important, as well as follow-up. So as we start a dosing regimen for a patient, we always start low and go slow. Everyone could be more sensitive. And so we have to keep everyone very individualized, especially with the endocannabinoid system. So some people may be more sensitive to others. We like to start at a good baseline, but you can really, research has shown very, very high levels of CBD intake being safe to use. But again, if a smaller milligram can be just as effective for them, then that's where we want to, especially for price, because of course, insurance isn't going to be covering these products. So we want to really keep everything, all those aspects, as we're talking to the patient, what they could prefer and what would be best for them and their lifestyle.
I could almost foresee like a future, like a sensitivity test. I mean, I like your approach right now, low and slow, right? Work the person up, but eventually there may be a way to really tap into the endocannabinoid system to understand how sensitive, I may be versus how you may be. But talking about that, look, I joked about it earlier, but in all seriousness, CBD seems to be everywhere now. Is there a preferred form of ingestion or intake, right? Because it's in bath bombs, it's in lip balm, it's in pills, it's in cookies, it's in drinks, it's everywhere. So how do you control that, and how do you recommend it?
I always recommend a sublingual oil, which is an oil that you're putting directly under your tongue and allowing it to dissolve into those blood vessels, directly going into your bloodstream. And this is because you're bypassing your metabolism. So when you're having to take an edible product, you have to be aware that your body's breaking that product down. And for THC specifically, this is why some people may have some interesting stories after THC edibles. Your body breaks that product down, and it can actually be even 4 times more potent than the initial product that you intake. And also it takes, up to 3 or 4 hours for the full effects to sink in. So you can redose and before the full effects have taken. And that's why some people would technically have an overdose situation going on.
Okay. So, interesting.
Yeah. So,
sorry.
Go ahead.
I was going to say there's also some, I don't know if you've heard of the Delta 8, but it's legal because it's synthetic. And so you can buy that in lots of different places where Delta 9, which is THC, is illegal. Have you heard of that at all, Keith?
Not me, no.
Yeah, so that's been interesting because there's so many different types of cannabinoids out there, and then there's all these different formulations that are coming out that people don't really understand. So it's a little confusing still too for the general.
So let me ask you, Dr. Crosby, when you're working with a patient, are you working with it directly? And let's just say my clinic or anybody who's watching it says, I want to start to integrate this into my practice. Is this something that you're actively doing, working with your patients, or is it a referral to Rebekah? And I believe Rebekah, the name is Rowdy Wellness. I see it on the shirt.
Yes.
So I actually have a private label through Rowdy Wellness called Odd Bliss. So it's designed for and supported for patients that have tinnitus in an audiology practice. Patients usually are referred to it by another professional, myself included, or I have some other professionals that are referring to it as well. So the fact that we can do the consult first is what I really like about that program. I do sell it directly in my office, but more recently, I've been trying to get the patients to have their consult, and then we'll figure out what they need and then go from there. I'm encouraging other audiologists to get involved in it through Odd Bliss, so they have the referral for the consult, but they could really use any CBD that they feel comfortable with if they wanted to do that as well.
Look, I've been in audiology a long time. I know a lot of people. You're the only person I know I would feel comfortable saying Noel knows her stuff. And so what I hear is there's this potential for, if you're listening and you're in hearing healthcare, and if you're like most of us, who 50% of your patients with tinnitus consider it bothersome, 10% or more consider it devastating, catastrophic. What would be the avenue to take? Reach out to Rebekah, reach out to Odd Bliss. What's the avenue to start to be able to offer this to patients?
Yes, reach out to me. I have a website, oddbliss.net. I have a Facebook page, and I also have a Facebook group. And we could get them started with information. I would really first want to educate somebody a lot about all the different things. And I've got resources on all those different places. So the person is educated about just what I've been through with it, and knowing that it's something that really could help their patients in different ways. We have a QR code that I can add. Oh, sorry, I guess my little blur for the and I'll let you have that. But that we can have that that's a direct link to the calendar, so they can schedule a consult with Rebekah.
Okay. So this is really a team effort between the two of you.
Yes.
Excellent.
And really, Keith, my goal with all of this was, when you have those patients who have gone everywhere and they've been told there's nothing that we can do for you, and they're so hopeless. I wanted to give people hope. So it's not just through the CBD. That's the biggest part of it now. But I also wanted to let them know there's alternative things that they might be able to try, that just so they don't feel hopeless. They can reach out, they can talk to us. There's resources available to them. Because
I swear, and you probably would agree, the audiologist, the ENT, anybody who says to a patient with tinnitus, there's nothing we can do for you, should have their license taken away. Yes. Because that's not true, right? No. We can't cure it. We also can't cure cancer or heart disease or most major medical conditions. But there are effective treatments available. There's indirect treatment. There's direct treatment. There's other ways to deal with, even if you can't necessarily suppress the tinnitus, we do have the ability to give people a better life.
Yes. And that was my goal, is just to be a resource for people where I could direct them to places where they could learn more about different things. That's where my
Sure. And I'm completely with you on that. Anything we can do for the 50 million people that are living with tinnitus, I guess I should say 26 million that are living with bothersome tinnitus, the 5 to 10 million that are living with catastrophic tinnitus. Absolutely. There are resources. And how, let's just say a patient stumbles across this, how would they get this free dosing consult or get to be able to speak to one or both of you?
I would say most of the time they would come to me through my Facebook page or my website, and they would contact me, and then I would say, this is what I would like for you to do first. My other goal is not to take them away from traditional treatments or any person that's been working with them. I'm just looking at them for this particular thing. So most of the time so far, the patients that we've seen have been referred by other professionals or by myself, or I don't really have a lot of general people reaching out generally that haven't been referred by somebody else. Sure. But the more we grow it, that might happen more as well. So,
and Rebekah, let me ask you: are you, is tinnitus, is hearing loss, is this your primary focus, or are you in other niches also?
Right when COVID started, we really had an influx of these tinnitus patients for whatever reason, whether it was side effects of getting COVID or side effects from the vaccines, or just being in isolation.
Just being isolated and being quiet, sure.
Yes.
She does do other things though. So like people have pain or other ailments. She works with all different types of patients.
And so what other, are there physical therapists you're working with, occupational therapists, sports therapists? What is that like for you?
We work with a lot of sports teams as a whole. Again, I come from a sports background, and I really wanted to provide an alternative option. Where out there, seeing many of my teammates go down a really tough path just from trying to feel good enough to play the next game, and that really changes their whole life. So I just, I wanted to provide an alternative option for them, and we go in and provide it for the whole team and track each athlete. And so that's really exciting for us. But again, coming from the Shepherd Center specifically, providing hope was the entire purpose. So going and working with tinnitus patients, that's really like what I truly love doing, is again, what Dr. Crosby was saying, just providing just a tiny glimmer of hope and helps someone change their entire life. So I know how important this work is, and I'm just really excited to be working with Dr. Crosby in this project.
Sure. Let me ask each of you, what do you see the next 5 years looking like in terms of integration of CBD, hearing healthcare, tinnitus treatment programs? Like, I think we're all finally starting to accept, like I said earlier, there is something that can be done for patients. Not a cure, but there is effective treatments available, from using hearing technology to try to, dial down or even kickstart neuroplasticity to really rewire the system. There's, cognitive behavioral therapy. Now there's CBD. So what does the future look like, at least the way you guys see it?
You want to go first, Rebekah?
Sure. I think we're doing it right now. Like, honestly, I think it's like a slow progress, but it's highly focused on education, educating the doctors involved, educating the patients, and also ourselves staying highly educated in this space. As more and more products emerge to the market, we always keep ourselves very, very focused on what is this new product? How does it help? Is it safe? Is it legal? So there's always something to learn, which is really exciting. But again, I think it's like a slow progress of Dr. Crosby and I going out and talking to people and finding opportunities to teach new upcoming students and new audiologists and other people who are interested in providing an alternative medicine. So we're really just getting ourselves out there and staying in a medical professional way about it. But, relying on Dr. Crosby's connections and going to different conferences, on this podcast with you, these things are going to be what's going to change the future, I believe.
I got to tell you, I came into this open-minded, and I knew that you guys talked about it in terms of alternative medicine. I look, in the little bit I've learned, right, there's an actual physiological process that's happening. I'm not sure I'm not sure why we would continue to use the word alternative medicine, right? If we can get the science to back this up, if we can get the evidence-based data, I would love nothing more than in 5 to 10 years from now, patient comes in, they've got some hearing loss, they've got bothersome tinnitus. Here's your treatment program that includes hearing aids and everything that's involved with that. Here's your CBD, right? Like, I don't know if I see that as alternative or supplemental.
Supplemental. I like that.
Yeah.
And I would just say the same thing that Rebekah said, but just more research being done, more, the cannabinoids can be separated out, where there's CB1, CBN, CBG. There's all these different cannabinoids that they're what would you say, separating or binding
isolating.
Yeah. And so I'm thinking that maybe some of those specifically we might find that it really does more than just the CBD alone. So just learning all of that, I just feel like it's going to really change things for tinnitus, but also for so many other types of ailments as well.
I love it. Thank you to both of you for being on here today, for educating me, for continuing to educate hearing healthcare providers, and ultimately, because what matters most is that we may be in the process of providing relief to more of the 50 million people that are living with tinnitus every day. And for that, I thank you from the bottom of my heart, as somebody who works with people that have tinnitus every day, family members who suffer with it. So thank you for all that you do, and for really pushing this from alternative to mainstream part of a regular, treatment and therapeutic process. So thank you.
Thank you very much for having us, so we can help educate everybody.
Yes. Rebekah, Noel, thank you so much for being here today. Take care.
Thank you.